I'm the president of SEANC. My name is Kirk Montgomery, and I want to talk more so about what's happening with the exorbitant prices that we have dealing with the pharmaceutical companies and the PBMs. As you all know, we had 23,000 state employees who actually were taking Wegovy as the weight loss drug, and the price of that was over $100 million. Our main concern is that we have reached out and we want to ensure that state employees can afford medication that they need. It's not just the weight loss drug, it's all across the board. We have discussed this in many aspects with different people, and the thing that we want to ensure is that we have the voice and the opinion that the people know that we have over 740,000 people that are on our plan. That's 1/10 of the North Carolina coverage inside of North Carolina. So our thought is that, what can we do to help offset that cost? Because paying up to 400% more than other countries, that's other countries in the United States for the same drug, is ridiculous. Even with the PBMs giving us a 40% discount, that still gives us 360% that we still have to pay for. We are looking forward to trying to push this through to ensure that the state employees of North Carolina have a way to afford the drugs and stuff that they need. This is a major concern across the board, not only with state employees, but also with Medicaid, Medicare, things of that nature. These prices need to stop. It is just corporate greed, as far as we're concerned, that's pushing this. Because if you can actually make a profit in other countries that's a lot less than what you're making in the United States, that's a big problem. We're looking at the possibility of, what can we do to change this? What are the offsets that we need to do to ensure that these companies understand that profit, it's understandable to make profit, but just to have the process in place to where you're making exorbitant amounts of funds dealing with this is something beyond our understanding. So, we have looked at this. We have talked to individuals. We are looking at trying to help push legislation to get this changed, because having people, state employees who cannot afford to take care of their families, because the drug was made for diabetes, and so what has occurred is that people were taking it and it was found to help with weight loss. But now we're having employees working against one another, because now they can no longer get the weight loss drug if they're obese or overweight, but it's still covered for people who have diabetes. But if you look at the bigger picture, if the people are losing the weight who are obese, then you won't have to worry too much more with what's happening with the diabetes and different things of that nature, other health-related issues. So our concern is that we want to ensure that we have the support of the legislation, we have support of anybody that we can to actually fight this and move forward and ensure that state employees are covered, because they're public servants and they deserve to be able to have a healthy lifestyle. If you have a healthy state employee, then you have better service, and that's what the citizens want. Thank you, sir.